Rachel, you mentioned a little bit what you're doing to kind of support and share, if you want to start first.
So a lot of what I do during my off hours from work is advocating in the community, particularly Prince George's County, with regard to substandard services, poor healthcare conditions, addressing in Prince George's County. We have a really low or egregious patient to PCP ratio. It's about 2,000 patients to one primary care provider in Prince George's County, and just other things in general. So I've been using my platform for that over the past month to really talk about the COVID vaccine and dispel some of these myths, because a lot of people just have bad information.
Are you directing anybody to go anywhere specific for good information? Like what's sort of?
Yes. So that's a lot of what I do. At the end of every conference I do, I say, these are websites where you can go to get good information, right? And we respect the media. We respect the media's position and job to keep the public informed, but a lot of times they tend to sensationalize things.
Yeah.
So if the media reports that there was a death of a person who had a COVID vaccine, it's usually that was the reason, but they don't take into consideration we've been in quarantine for over a year. Chronic health conditions are getting worse. So patients in general aren't as healthy. So I tell people you can visit the CDC, and we have 3 medical organizations in our backyard that have been leading the forefront in COVID information. That's Johns Hopkins, MedStar, and University of Maryland Medical Systems. You can go to their website and get good information, because you can't trust everything on Facebook or Twitter. You can't trust the information that's coming down from the telephone gang as well. So I, like Dr. Bush mentioned, I also went public when I got my COVID vaccine, both shots. I put that information up on Facebook. I shared it with friends, and that opened the conversation. People would call me. How do you feel? My mom must have called me every day for 2 weeks. How you feeling? I'm like, Mom, get your shot. And she's a healthcare worker. She works at GW, but every day, the first day was every hour. She's calling me. Are you okay? How do you feel? Can you still hear? Can you still taste? And I'm like, I have work to do. You got to stop calling me.
I'm fine.
But literally people were so worried because they had such bad information. And then when you talk about it and you talk about how the vaccine was in the works for almost 20 years because it's a coronavirus, and you talk about how it was developed and that it didn't come from the bodies of aborted fetuses, people are like, oh, this makes so much more sense. And they're more willing to get it. And I never force people to get the vaccine. What I do encourage them to do is talk with their medical professional, in whom they should trust. And if they don't, find a medical professional that they trust, get good information and make a good informed decision. And most people usually come back to, you know what? I think getting the COVID vaccination is going to be good for me, my community, my family.
Yeah. Avis, I saw you shaking your head.
Yeah, right. Everything Rachel said.
What she said.
Yeah. I mean, I had my first vaccination. I did go get it. And I tell you, when I walked into Anne Arundel Medical Center, I just felt a sense of relief. Like, okay, we're here. We're not all the way there. We got to climb up that mountain a little bit, but we're here. So it just felt good just being there and getting vaccinated. So I was one of the first ones in my family. And then right after me, then my parents fell in, my sisters, fell in. So, and I'm spreading the word too. I don't have a big platform like Rachel does, but I'm spreading the word in my family. Get vaccinated.
Yeah.
So,
Yeah. With me too, I was the first one in my family to get it. Can you believe it? I ran for that vaccine.
I'm sure, Genevieve, you're like, okay, I had COVID.
I don't want it again.
I need that vaccine today.
Yeah, I'm like, how much harm can it do to me now? I just want to get it. And I'm from a family of medical people, nurses and all. They were hesitant. I'm like, I am gonna go get it. So I took the first shot. I was a bit dizzy after I took the first one. Wasn't sure whether it was from the vaccine or part of the lingering symptom, but I'm like, whatever, I will get over it. And I did. With the second shot, I had more migraine headaches for days. I think they're a little better now, and I think the migraines I'm getting now are from lingering symptoms. But if I have to do it all over again, I'll do it the same way. And I have been advocating. My husband took it. My son, who is 27, is the stubborn head. He was like, "Ma, I don't think I want to take this vaccine because you don't know what they do to Black people." I'm like, "What? What's my color? I don't think I'm white." I said, "If you don't want to do it for you, do it for your mommy. You've watched me suffer. Please go do it." So he took it. My oldest daughter, he's a registered nurse. She called me to, "Mom, do you think I should take it? Are you sure?" "I don't know. I think I want to get pregnant soon." She just got married. She says, "I don't know if it will affect me if I won't get pregnant because I take the vaccine." I'm like, "Sure, go take it." So she has taken it. So my family has taken it. I continue to advocate. I got my brother who lives in Frederick. He didn't want to take it either. But I talked and talked, he's taken it. I'm advocating to church members, to neighbors, anybody I know, my family, my patients. I'm doing a lot of telehealth visits. Today, I managed to convince 2 of my patients to go ahead and take it. As Rachel said, it's all we have. And as Eric said too, to help out now. And whether we like it or not, COVID is going to be here for a while. Yeah. So we need to protect ourselves as much as we can, especially since the Black and brown population are dying more disproportionately compared to the whites, and Black History Month has brought it back to us so that we understand why they're really and truly hesitant in taking the vaccines. So I tell them, it's even more important for them to go ahead and get it.
Yeah.
I applaud all of you guys because when I went to take my first one, I was anxious. I was nervous. I was like, I don't know, should I do this? So I have one of those little fitness tracker things, and it has a stress meter on it. So right before she gave me the shot, I happened to look at the stress meter. It was all the way to the red. I was like, all right, you're working in a community setting, you're working with people that are fragile. So this is not only your responsibility to yourself to keep yourself in good health, but also your responsibility to the people that you're working with, So the first one was no issue, similar to other people, though. The second one, I did have a little bit of chills for probably about 12 hours, and I've been fine ever since. My mom will tease me and she's like, have you grown a third eye yet? And all of this stuff. And I'm like, no, Mom, I'm still left with the two rather large eyes. So it's definitely something that I'm advocating for within my group of friends as well. My husband, he is absolutely ready to get it when he can. And, most of my friends in my cohort have, if they haven't gotten it as yet, they're in the process of, registering for it. So all in all, not a bad experience.
Yep.
Now that I've been through it.
Excellent.
And Dr. Bush, I'm glad that you mentioned about Mr. Rutherford, governor, getting it, because it's good to see politicians advocating on the right side of medicine.
Yep.
I have a colleague at Georgetown, Dr. Graham Lubinsky. He's a intensivist. And he put this quote up that was so prolific at the time when we were looking at our administration talking about hydroxychloroquine, people who aren't medical professionals spewing out the names of medicines, right? So he said, politics has no place in medicine when it comes to patient safety. Yep. We really need to depend on medical professionals to give good information. And then you see politicians or other leaders following suit. And I just thought that was really good. And it's been really good to see people stepping up saying, I got the vaccine, celebrities and other persons alike.
Yeah, no, I agree. I mean, that's definitely the kind of role modeling that we need at this time. For me, getting the vaccine was a relief. I felt very relieved, especially given all the COVID patients, all through the year. And my wife was also very happy because, there's a lot of, she's Filipino, and there's a lot of Filipinos that have a lot of distrust, as well as Asian cultures that do not trust vaccination, a lot of the other things. So she was happy to post it on Facebook, and it went around the globe. So that was a good thing. I think the frustrating thing for me was the vaccine distribution rollout plan, and just knowing that really there wasn't a place for hospice, for home health, for a lot of the providers like us that are out there in the community every day, who deal with the most frail and those who are most vulnerable to this. And that, I think, was a frustration for me. And it took a while to break through that. So, you know, I feel like that was an unnecessary barrier. I'm glad we're past that. But I think, you know, lessons learned for next time around. Yeah.
Well, I so appreciate you guys, your time, your insights. I want to thank the John and Kathy Belcher Institute for their generous support of the community education programs at Hospice of the Chesapeake. Thanks.